So we are here with Dr. Hanna Katan. Hello and welcome.
Hello, thank you.
You are American born. You've been here living for 49 years.
Yeah,
You're a gynecologist, a sexologist.
yes.
Can you explain to us a little bit what you do? I mean, this is amazing.
I'm also a Rebbitzin, and and also a mother of a big family, Baruch Hashem, grandmother.
13 children. Good night, her.
Um, Gynecology is obstetrics and fertility and gynecology. I deal basically more with fertility, and also with adolescent medicine and a little bit menopause. And I see a lot of kalot, brides who
Brides.
come and to prepare them for the wedding. And I deal a lot with women who want to feel happier in their intimate lives. And it could be because there's a problem with desire, it could be a problem with arousal, it could be, and these are things which today are more, we deal with much more, maybe because of the feministic movement. I mean, to talk more about what a woman feels about and how she can feel better. But this, of course, is to strengthen the family, because if the couple feels good together and the woman feels good, and then the family is getting stronger.
So let me ask you a question, and is how important are the laws of purity within a sexual life, a happy sexual life in a couple?
I'll tell you a story. I was for a long time, I was in a group of sexologists, women sexologists, very, very different from me politically and philosophically, everything. And there was one of the sexologists, very, very senior sexologist, who went to a special course in India, I think it was, paid a lot of money for it. And she said she came back and she was really something very revolutionary that we're talking about, that if you want to deal with a female desire disorder, which we see today, FTD, all over the world, one of the clues might be 1 week in a month not to touch each other. Really something revolutionary.
Wow.
And we know that the divine knowledge about what our body and what our soul needs is really very, very perfect. In other words, this to be close and to get back
Detachment.
and the back and forth, attachment and detachment, and something which especially for the desire of the woman, also for the man. And as the years go by, it becomes more and more important.
Yes.
It's something very special. It's something which, without divine thought, nobody would have think about it.
Incredible.
Yeah.
I don't know how couples survive without implementing these laws.
That's right.
They are survival.
And
I
you
think.
you need your space,
Absolutely.
your physical space, your
Absolutely.
emotional space. Have time to also to be able to
To communicate.
to communicate in other ways which are not physical.
Right.
And this is really something which we're very happy that we have this present. We have this special present, which means Tarat HaMishpacha.
Dr. Katan, how can you influence this new government hopefully coming in the new election? What is your role as a doctor, as a religious doctor, and as a rebbitzin to the new elections coming up?
Well, I'm not. I don't have I don't have a public position I am a publicist, but
In the health system.
in the health system, I deal with women's medicine. I would talk a lot about preventive medicine. I would, as I said again, oocyte freezing, extremely important.
Wow.
Very, very extremely important. Adolescent medicine to deal a lot with the body image and eating disorders and things and depression, which we see in the young age because of corona and other stuff which is coming up, and then we see that afterwards it affects their general health. To try to subsidize the third, fourth, and fifth pregnancy of a woman who needs IVF, maybe for male infertility or something like that. The first and second pregnancies are subsidized, not more than that. And I think that bringing a healthy child into the world, if we're talking about a young woman who needs IVF, I think that's something that would also be very good if it could be done.
How is the health system in Israel?
Wonderful.
That's what I thought.
A wonderful
I wanted
health
to be
system.
sure.
Wonderful health system. Also, in terms of fertility, we have the most IVF units per capita in the world because it's a very important. It's important for this country. But in general, the health system is very, very, very good.
Compared to America and to Europe.
We have a lot of tourist medicine, people coming in, not only for IVF and stuff like that, but just for general medicine, definitely.
What about money? How expensive it is here?
I
to
don't
be
have much to
healthy?
compare with, but I can say that it's because of social medicine, it's much cheaper than it is in America.
Yeah.
Nothing to talk about. And we have, as I said again, we have the primary medicine. We have secondary medicine, which is Kupat Cholim,
Right.
before you get to tertiary medicine in the hospital.
Yeah.
And that solves a lot of problems. And we have a lot of medicine which is proactive. You have nurses calling you up and asking, did you do this test or whatever? Have you gotten the injection for corona, whatever? That's something you don't have in America, just left alone.
It's true. Breast screening is such an important subject for women. From 40 years old, from 50 years old, how does it work in Israel? Give us a clear picture.
Well, in Israel, the consensus is from the age of 50 to do a mammography. Before that, we would like a woman to see her surgeon, her breast surgeon, and be checked once a year.
Like a manual checkup.
Yes, if she has a fibrocystic breast or something, maybe more than that, maybe an ultrasound of the breast. If she's in some kind of high-risk population, there's a breast cancer in the family, BRCA, whatever, she might do it before that. But that's the general status. And I know that in America, there are many places where it's done from the age of 40. We do it in Israel from the age of 50. And I think it's pretty good. There's a lot of reaching out to patients, an awful lot.
To do a mammography when it's not needed, it's not healthy also, right?
Of course not.
It's very,
you do it
it's
when
very
you have
attacking.
No, mammography, the yield of it is the fact that you can find a very, very small lesion before it's palpated.
Right.
Many years before it's palpated, because you get to 2 centimeters, it's very big.
Yeah.
So that's why the mammography is very, very effective to prevent acute bad prognostic breast cancer, and to find a very early stage breast cancer, which can turn into a chronic disease. A woman can live years because she found it very, very early. It's a very important checkup.
So the women should go out, have manual checkups from 40 years old, get a mammography after
From
50
30.
years old, and be on it. Be aware.
Even from manual checkups, even from the age of 30.
Wow.
To learn how to check yourself in the mikveh, it's a great time to do it.
Right. So here
Once
we go.
a month,
Combine both
you're
of them.
checking yourself, look in the mirror, palpate, know what your breast is like. Most of the lesions are found by the women themselves.
Incredible.
But we should all be healthy. B'ezrat Hashem.
Thank you so much. Thank you for
You're
giving
welcome.
hope also for women who want children, who want to
B'ezrat
have big
Hashem.
families. There's always hope, huh? There's
Mamash.
always hope.
Of course there is. Of course.
You heard it from the
B'ezrat
doctor.
Hashem.
Thank you so much.
You're welcome.